Hello, everyone. Welcome to Season 2, Episode 1 of Healthy Politics. I'm joined today by Lance Lankford. Say hey there, Lance.
Morning, everybody. Glad to be
Lance
joining for.
is stepped in as the compliance director for Holmes Murphy, and so he and I will be tackling all issues related to this intersection of health and politics. A couple of things on our agenda today, and maybe we start with go back to the government shutdown. You'll remember from last year was really around the Obamacare or ACA enhanced subsidies. And would those stay? Would they go? Nothing got resolved in that. Well, we got a budget, a Consolidated Appropriations Act, or CAA. And the CAA did not include those enhanced subsidies. So they are still not there. And basically what's happening is that about 20 million people that are in the ACA marketplace are paying what they paid pre-COVID. So it's the same subsidies that were in the original Affordable Care Act, but the enhancements through the COVID era relief went away, and that's kind of where we are. Lance, any thoughts on the subsidy football that goes back and forth in DC?
Yeah, I think both parties say they want to extend the subsidies, and I think as the subsidies typically are increasing by more than 100%, or the premiums that folks are having to pay. So I think not only is it increasing healthcare costs dramatically for a lot of people, I think we'll see folks, the adverse selection happening even more now that there's the folks that were this may have stayed on the plan but don't need health care as much as some other people now will not be obtaining policies through the marketplace, which will increase costs even more as that adverse selection goes on. So, until this gets addressed, I think it's just going to be a downward spiral for the cost of healthcare in the marketplace.
Yeah, we did see the rates spike because the insurance companies were having to price in this unknown item, and so the rates did go up on 1/1 to kind of price in this uncertainty and potential adverse selection. Interesting part for me, and this is this may be the devil on my shoulder talking in terms of that, but it almost makes me wonder now whether Democrat leaders would not support any kind of compromise from Republicans so that they, in the midterms this year, could run on, look what Republicans did to increase healthcare costs. I don't know that's going to happen or not, but there is the pessimist in me that says this could get politicized and continue on. But we'll see. Second piece that was in that budget act, the CAA of 2026, which I didn't see coming in this, so it was a bit of surprise for me, was some pretty hardcore pharmacy disclosure around PBMs, and and they've got until January of 2029 to get all of this figured out, but very robust reporting for both insured and self-funded plans, anyone subject to ERISA, on really a full transparency around the money chain in pharmacy and who's getting paid where, and requiring 100% of all rebates go back to the plan or the plan sponsor if it's self-funded. I didn't see that PBM transparency coming through the CAA, but it's sure there.
Yeah, it's interesting. I think the PBM and the cost of prescription drugs in particular, as we know, have been really the piece that's been driving up our claims for our clients. And so, that has been a focus by both parties. President Trump obviously has focused on that with his own TrumpRx, which we'll talk about here in a second. With other folks, pretty prominent people like Mark Cuban entering the space and trying to drive down costs. I think it's something that Congress, realize that this has to be addressed. That doesn't necessarily mean they'll always address it, but I agree. I think it's surprising that this was included here, but as you noted, there's some pretty significant obligations on the part of PBMs to fully disclose their pricing, which, as we know, has been an issue for years, and that trying to decipher what the actual costs of the drugs are is almost impossible. But at least this is a big step in that direction, and clearly having to pass the rebates fully through to the end users is something that could dramatically decrease the cost of prescription drugs, and at least allow plans and their members to figure out what we're really paying for drugs.
Again, and we've got until 2029 for this to get implemented. It's a lot more to come on this, but just know it's in the horizon, and it's not something that requires any other approval. It is done. It was part of this bill, and so it is done. There was I think it was a Department of Justice item that was out there on PBM transparency. And so from the things that I've read, there needs to be some cleanup between kind of what was happening in a regulatory agency and this that was in the bill. But just know enhanced PBM and pharmacy transparency is coming. Interesting that was in this Budget Act, because that's also in a Consolidated Appropriations Act of 2021 is where the third party transparency for brokers, consultants, and others, all the transparency reporting requirements, it was in a Budget Act that was there. Some of the things that I've read were that 2021 Act was intended to include pharmacy benefit managers as consultants in the healthcare chain, but they avoided that, said it didn't apply to them. Now they made very clear, no, this applies to you. Oh, and we're going to take it even further. So very, very interesting. Again, stays with the Republican approach of transparency and consumerism being kind of the heart and soul of their healthcare strategy. You mentioned TrumpRx. That's the other pharmacy item that has come out since our last episode. Talk to me a little bit about your thoughts on TrumpRx.
I think it's certainly a nice alternative to be able to have some transparency and perhaps obtain drugs at a lower fee. It doesn't necessarily really impact folks that are covered through their group health plans. It's really, either folks that are uninsured or that are paying cash for prescription drugs. So for those folks, it certainly will impact that and allow them to obtain their prescriptions much cheaper. But again, as it applies to, the employer-sponsored plans, folks are still going to be more than likely better off going through their plans to obtain prescription drugs. And so, for most folks, that probably won't be a big impact, but it is for the folks that are in the marketplace or looking for alternatives to high cost healthcare. This is certainly something that could be appealing.
Yeah, I went out to the site and tried to kind of do a little shopping just to see how does this work, and it's very interesting that it is very clear, and you have a little statement that you have to attest that says that you don't have insurance if you're going to use this and not going to try to file for insurance. So it really is, it's a segment of the population that is there. It does, especially if you go to the site and kind of walk through it, it does make very clear the price discrepancy that that folks in the United States are paying versus other parts of the world. Kind of highlights the most favored nation pricing. So very much on brand for the Trump administration in a couple of ways. One, it doesn't include the middleman, who kind of seems to be the enemy. So doesn't include insurance, doesn't include PBM. This is a direct to consumer between you, the consumer, and the manufacturer. We have negotiated a price that would be competitive with what you could get in the rest of the world. I think it's 6 manufacturers right now. So it's not, it is a long way from every drug, but it it's a meaningful item out there for people that are purchasing drugs on their own, but it very clearly tells you check other sources, check your insurance. Even things like GoodRx, there are rumors out there that GoodRx is actually the engine behind this. I don't know whether that is or isn't true. So an interesting on-brand item that's there. Let's maybe, since we go TrumpRx, go to the great healthcare plan. Which was announced and is on the whitehouse.gov healthcare, the whitehouse.gov site has the great healthcare plan. It's really the Republican platform that is out there. In my view, it's really not a plan. It's just kind of a few ideas. Kind of your thoughts on the great healthcare plan?
Yeah, I agree. I think it is a great high level idea, which I think we have seen a lot of over the years. The proof is when putting the meat behind it and how it's going to be administered, what the specific requirements are, imposing penalties for folks that don't follow the, requirements, which is an issue with a lot of the things they've enacted over the past couple of years related to healthcare. So, I think some of the things like the most favored nation drug pricing and providing more and more transparency, I think is what we all want to see. And if it gets to that, I think the rest of the goals and kind of what's outlined with lower costs, lower premiums, and some other things that they have outlined in the great healthcare plan will follow. That's really, I think, again, it's providing some guidance until we actually see what's behind it. I don't know that we'll know much, but as we mentioned earlier, the fact that the PBM legislation was included in the CAA was a surprise and certainly a significant advancement on trying to lower costs and providing transparency. So each step that happens through that process, I think, is a good thing. And again, as we've talked about with some of this really kind of focuses on some of the things President Trump has really talked about. Obviously reducing costs, kind of providing subsidies direct to the consumers as opposed to insurers. Letting the folks pick their healthcare a little more and have the money in their pockets is important to him. And ultimately trying to reduce the costs, I think, is where this gets to. And if this can, every step we take toward that is a good thing.
Yeah, it really is. If you go to the whitehouse.gov site, which I'm sure all of you have done to to see what's there, it's really aspirational statements. We want lower drug prices. We want lower insurance premiums. We want plain English insurance. Get away from the jargon. So it's kind of these things we want without really saying much is there. Other than one thing that I found very interesting in the Great Healthcare Plan, and I'm not sure how it got in there because President Trump has been, as I think we all know, very critical of Obamacare, the ACA, and the insurance company role in that, and it's a scam, and it's it just you don't want to give these billions of dollars to insurance. I mean, the comments have been many critical of that, and yet one of the probably the most specific item in the great healthcare plan that I saw was a reinstatement of the cost sharing reductions that would lower Obamacare premiums by approximately 10%. And let me give a little history on this one because it shocked me that it was there. So the cost sharing reductions, that was part of the original ACA, where people between basically less than 250% of federal poverty level, you would buy a plan, you'd buy a silver plan, but you would actually get a richer benefit. So the federal government was going to pay the insurance companies to lower deductibles and out of pockets for lower income Americans. That was the concept, and they were there. Well, President Trump ceased those payments in October of 2017, and they have not existed since that time. They went away. And so insurance companies raised the premiums for everyone to cover this lack of funding from the federal government. And in the great healthcare plan, there's this odd reinstatement of something that the Trump administration got rid of. And the reason that it says it's there is to lower premiums on Obamacare, which he's been very critical of Obamacare. So I just found it very interesting that there was this odd, very specific item in that plan to reinstate something that Republicans and President Trump at the time very clearly, specifically got rid of and said was unconstitutional. So fascinating, but that is politics and healthcare, and I again just goes with my statement that I don't think they know specifically what they're doing. Somebody has an idea, something they like, and it gets in somewhere, and nobody realized, oh yeah, we were the ones that wanted that out before. Interesting to me.
Yeah, I think it's, and you see some of the, originally President Trump wanted to get rid of the ACA entirely. So maybe that's a little bit of a shift, exemplifies a little bit of a shift that he's either accepting that it's here to stay, or he realizes it impacts enough folks that he needs to keep it. I think the interesting piece, which we're kind of seeing a little bit through all of this, particularly with the new PBM legislation, is I think for the most part, the parties are at least united that they have to do something. A perfect example is the most favored nations clause for prescription drugs. Why are we paying 6, 7, 10 times more than other countries, developed countries in other places in the world for the same drug? That makes no sense. And it's an easy talking point for opponents of the high cost of drugs and everything else. So I think those types of issues that are easily, set forth in sound bites are becoming part of policy, that they're at least doing something to try to lower the cost of healthcare.
Mm-hmm. Kind of one last item, and this one actually, unlike our other topics, it is not red or blue. So probably nice to talk about something that's not partisan in terms of what's going on in DC on that. But it is Medicare Advantage funding for 2027. And the reason that I think this matters to our clients and anyone involved in the employer-sponsored health insurance space is that when the federal government or any government takes actions that constrict payments in the healthcare system, that balloon gets squeezed and it creates more cost pressure in the private sector. So here's what happened, and it was signaled a year ago. There's a congressional advisory group called MedPAC. They advise Congress on all things related to Medicare funding. And a year ago, they signaled that they were concerned with Medicare Advantage. And Medicare Advantage, for those of you who aren't familiar, that's the private alternative to Medicare. So if you're eligible for Medicare, you can take traditional Medicare, or you can opt out, and it's known as Part C or Medicare Advantage. You can buy a private insurance plan. The money from Medicare goes to the private insurance company, United Healthcare, Humana, Blue Cross, whoever it might be, and you get their coverage. So you typically get more benefits if you will go with a private insurance. And about half the people are in traditional Medicare, and about half the people in this country are in Medicare Advantage plans. So it's a big deal. Choice in Medicare is very popular. And what happened is MedPAC last year had some analysis and said that we as taxpayers are paying approximately 20% more for people to be in Medicare Advantage than in traditional Medicare. And so it signaled that we were going to get some tightening of the belt around Medicare Advantage funding from the federal government. And that got announced in late January. And the effect is a 0.09%, so basically nothing, expected funding in 2027 versus 2026. So effectively no increase. But it's interesting how they got to that, because they did actually pass through a growth rate on the inflation side of 4.97% or 5% increase in the price component that was there. But those in advising around Medicare have become very concerned about coding practices by insurance companies and by medical providers, saying that people actually maybe have or are sicker than they might otherwise appear to be. So effectively, what's happened is Medicare is cutting back or ratcheting down on some of these coding practices, removing some elements that otherwise were eligible to increase the funding, and so the basically net zero is coming from a crackdown and methodology in the coding. This is on top of some Biden era implementation. There's a 3-year phased in. Look at my notes here. It's called V28. It's a different coding. So you had a coding element for all of Medicare that the Biden administration had gone after. And now you have this coding area for Medicare Advantage that the Trump administration is ushering in. So I think you see the red and the blue team both being very sensitive and very aware of coding practices within the healthcare system that are driving up the cost of Medicare, and they're cracking down on those things. Bottom line is that if this actually gets finalized, and it'll be about April before it's finalized, but if what has been proposed gets finalized, and it most likely will, you will see significant negotiation pressure within the private health insurance industry, because you're going to see the insurance companies trying to increase their margins, and you're going to see the healthcare providers trying to increase their margins, because these cuts to Medicare are very significant. To give you a sense, and kind of in the for-profit world of health insurance, Humana, who is pretty much exclusively Medicare now, their stock price dropped 31% in 48 hours when this announcement was made. And it has not recovered. It was very, very significant. United Health Group, in 24 hours when this was announced, their stock went from $351 a share to $282 in one day after this announcement. So the markets saw this as a massive issue towards the insurance companies that are there. For our clients, this probably doesn't make a lot of news, but this is going to be cost and coding pressure. Unfortunately, most of the carriers don't allow the audit rights to be able to see the coding side of this. Bottom line, it's more inflation pressure in 2027 for our clients.
Yes. And I think that's, one of the things that clients have to be aware of, if they, to the extent this would be applicable, is just, as they negotiate their administrator agreements going forward, having the ability, if they can get it, to additional audit rights, or more, not having some of the obligations that they have right now, to basically let the administrators operate kind of however they see fit, and giving them wide breadth to approve claims, not have an audit system in place that deals with specific claims, as opposed to kind of an annual check on the overall performance. So, those are things that, certainly be aware of as these types of procedures and policies get implemented. There will be the opportunity to address them through those documents and contracts as you move forward.
Yep. So if I summarized our discussion today, I'd probably wrap it up like this. I would say we've got ACA or Obamacare chaos with the subsidies, unknown, who knows what's going to happen with that. A lot of transparency around pharmacy going on, trying to get more consumerism available in that space, and more to come as it evolves over time. You've got a squeeze on the government side of their funding that's going to put pressure on our clients. And it's a midterm year, and we'll see where the Republican and Democratic stances go. looks to me like the Republican side is settling in on consumerism, transparency, um, uh, that pathway with the great healthcare plan and the actions that have been taken. On the Democratic side, I think you're going to see a protection strategy, protect Obamacare, protect Medicare, protect Medicaid. I think that's going to be their word. Both sides will lean into the word affordability. I think that's what this year is really playing out to.
I agree. I think affordability and transparency, which you alluded to, and transparency kind of leads into affordability. At least that's the hope. So I definitely agree. There's certainly the opportunity for that. It looks like on a bipartisan basis, even with different focuses, that is moving forward.
It is. And the other thing that I would say for our clients is, and unfortunately, none of these items are directed at helping you and your costs. So
Correct.
you have to lean in, do the hard work and heavy lifting, because from either the red or the blue team, there's not anything really right now that's around trying to help employers contain their costs. It's really the other parts of the system where the focus are. Lance, thanks for joining.
Thank you, Dan.
And thanks everyone for watching today. If you've got questions, reach out to your Holmes Murphy team. We're always happy to talk. Thanks.
Thank you.